Well, welcome back to Open Exchange. Healthcare in Africa varies from the most basic primary healthcare, not at all, offered for free by the state, to highly specialised high-tech health services available in public and the private sectors. Around 60% of healthcare financing in Africa comes from private sources. About 50% of the total expenditure goes to private providers. Now, Fredray Meyring, who's Debt and Capital Advisory Partner in Corporate Finance at Deloitte, joins us for more. Morning, Fredray. Good morning. What's the problem here? And one talks about the African growth story. One talks about all these countries in Africa that are experiencing growth. But in all of them, often the phrase comes up, there's plenty of money, but the money isn't going into the investment that's required. Is that the case in health as well?
I think definitely so, specifically on the continent. And there's a specific dynamic that's causing that, really. I think healthcare in general, you can split in two, the public and the private. Largely, the public is driven through government and government's commitment to provide that to its citizens. And that's obviously the biggest market, specifically on the continent. And then the private sector healthcare market, which in Africa is largely based on the insurance business. You know, in terms of, and therefore the affordability of it. In terms of the numbers in the continent that can afford private health, I think at this stage that's very low, and that obviously creates a certain dynamic and creates a certain dynamic for the private sector to invest in that and fund that. Obviously on the counter to that, where you've got the governments, as we understand and we know, governments take a long time to put these things in place. They are looking at different models to do that and to fund that, because ultimately they also realize that they need to provide these services and these basic services really to its citizens. Not just from a moral point of view, but also in terms of longevity, trying to extend the life of its citizens and therefore hopefully getting increased tax base and just creating a greater economy.
What kind of activity is going on in the space? I mean, you're an expert in debt and corporate finance at Deloitte. What do you spend your time doing in relation to things like health? What are the activities? What are the issues?
What we tend to do at the moment and spend quite a lot of time on at the moment is advising clients in really structuring the funding side of some of the transactions so that they're looking to expand into the continent.
Example?
A private hospital or the construction of a private hospital in one of the countries, and really to put that transaction together such that the funders are interested to fund that, but also that all the risks are really managed in terms of who will be the doctors to service the patients, how will these medical costs be financed, is there a medical aid industry or sector in a specific country that can stomach this and that type of thing. So we will put that together, get the different parties involved, and try and add value to that.
Is it a busy field?
I think what we're seeing at the moment, there's a lot of inquiries. There's a lot of belief that there's great opportunity, I think, but it's still early stages. I think there's quite a lot of dynamics that still need to play out. So from an appetite point of view, a lot. From an opportunity point of view, I think we're still seeing the dynamics starting to play out and how to get the investors and the operators' minds around how to really operate in specific markets, because the different countries have got different markets and market dynamics, and that's quite different from what we see in South Africa.
When you say investors, one thinks of big South African companies, for example, the three big hospital groups. You think of the pharmaceutical companies like Aspen. You think of a Discovery in the medical aid sector. They've just reported their results. In a sense, there's nothing stopping them going into a country and saying, right, we're going to set up business here, we're going to build a hospital, we're going to employ doctors, and if you can pay, you come here. But that's simplifying it.
That is simplifying it. As we all know, they're really looking after shareholders' funds, and it's also an opportunity cost to an extent to say, you know, where can you get the least risk for the greatest return, and how do you quantify that risk and how do you quantify that return?
Do you help them do that?
We do help them do that. You know, we get involved even at the early stages where we can help with these feasibility studies and the likes to try and get a sense for the market and the opportunity and that type of thing, and trying to quantify that. So we get involved at that early stage, right up to the physical funding of the construction or putting the whole transaction together. If
you could say that there's a couple of hard lessons that you've learned while being involved in this, what would they be? You're in a different place now to when you started.
Agreed. I think what is very important is not to make the assumption that any other country on this continent and any sector in those countries work the same as it does in South Africa. It doesn't. There's different dynamics. They're at different stages of a life cycle. And what we've learned is you have to be on the ground. You have to have people on the ground to really understand it and live the life of those people, and not just to send someone in for a week or 5 days. You've got to be there, got to understand it, see what the challenges are, see what the small nitty-gritty stuff is. For instance, how do you distribute pharmaceuticals? Do you get someone to get on a bicycle and go and deliver it in a little village? Because it's a different dynamic than it is necessarily in South Africa. So that's the type of things that we're seeing that is critically important to get that understanding of the specific sector before you even approach it.
Countries that come to mind where things are quite advanced in establishing things like medical aids, private hospitals, good pharmaceutical distribution and availability. Some must be better than others. Which are the countries that are standing out outside South Africa at the moment?
A lot of our neighbours, Botswana and Namibia. We're starting to see Kenya developing, Ghana, really Ghana, Nigeria, and then on the east, Kenya and Tanzania. That's largely on the private side. I think there's quite a lot of activity continent-wide where governments are trying to get closer to or trying to supply those services and get some sort of a model going so that they can effectively supply those services to the public.
Fascinating stuff. A long way to go. Thanks to Fredray Meyring, who is Debt and Capital Advisory Partner in Corporate Finance at Deloitte, but specifically talking about health issues in Africa.